Welcome to this explainer. Okay, today we're diving into the incredibly complex and frankly fascinating ecosystem of healthcare data governance. We're going to map out what is essentially a massive game of legal hot potato. We want to know exactly who holds the liability when patient data flows through a modern medical network. It sounds straightforward on the surface, but as we start unpacking the details, you'll see that the web of relationships in modern healthcare makes data ownership anything but simple.
So the absolutely crucial point we're anchoring this entire explainer around is this powerful quote from our source material. Every data breach is also a patient safety event. Wow, that completely changes the stakes, right? This isn't just about protecting a credit card number or a password from being stolen. When medical data is compromised, altered, or even just unavailable, it directly impacts real clinical decisions. It proves that compliance isn't just about paperwork or ticking boxes, it's fundamentally about human lives.
To unpack all of this together, we'll follow a quick roadmap. Number 1, we'll look at the integrated compliance team. Number 2, independent diagnostic centers. Number 3, telemedicine and subordinate hospitals. Number 4, the consulting doctor dilemma. And finally, number 5, umbrella brands and franchises.
All right, jumping right into Section 1, the integrated compliance team. Think of this as the core command center inside the main hospital walls.
So how do modern hospitals actually structure their defense? Well, because a data breach equals a patient safety event, governance simply cannot be siloed anymore. Our source outlines a necessary triad, working together as one unit. First, you've got the Chief Information Security Officer, or CSIO, handling India's Core IT Act, ITA 2000. Second, the Data Protection Officer, the DPO, managing the new Digital Privacy Law, the DPDPA. And vitally, the third is the Patient Safety Officer, or PSO, who handles the hospital's NABH accreditation standards for quality care. These three roles absolutely must operate as co-owners of a single integrated compliance plan.
Having that rock-solid team inside the fortress is fantastic, but we have to ask, what happens when patient data ripples outward to external entities? Healthcare is super collaborative by nature, which means sensitive data literally leaves the building all the time, and the second it crosses that threshold, the liability shifts.
Which brings us to Section 2, independent diagnostic centers. This is our first satellite entity, and it immediately dials up the complexity. Before we analyze these external centers, we really need to nail down our baseline terminology. What exactly is a data fiduciary? Well, put simply, it's the entity calling the shots. They are the ones determining the purpose and the means of processing patient data. Essentially, if you're the one deciding why and how the data is used, you're the one holding the liability bag.
And this brings up a major vulnerability for hospitals. Think about those independent diagnostic labs. They aren't just acting like a courier passing an envelope back and forth. If a lab runs a blood test and makes a clinical recommendation based on it, they are actively determining patient safety actions. According to our source, this independence means their exact status in the data chain needs to be firmly established right away because they carry direct responsibility for the outcomes they influence.
Let's speed things up a bit and imagine a highly technical, fast-paced scenario. Who is liable when data crosses physical borders in real time? Picture a specialist in a major city guiding a really delicate procedure in a rural clinic hundreds of miles away.
That leads perfectly into Section 3, telemedicine and subordinate hospitals. This is where physical borders blur entirely and data just flows continuously. Here is where a new concept pops up: joint data fiduciaries. This classification applies when two or more entities are essentially sharing the steering wheel on data processing. The vital phrase here from our source is that they must settle their inter se status, which is really just a fancy legal way of saying they have to explicitly define the operational boundaries between themselves on paper.
So here's how this plays out in real life. When a main hospital is providing remote surgery support and actively collaborating with a subordinate hospital receiving that support, both entities are steering a patient's care. They must rigorously settle their boundaries for data responsibilities. Think about it, if the video feed drops mid-surgery or a scan gets corrupted in transit, there is zero time for pointing fingers. They must have a recognized boundary for their joint responsibilities mapped out way in advance. But wait, that brings up another fascinating mystery in our ecosystem map. What about the individuals moving freely through the hospital itself? When an independent consulting doctor walks the halls and opens a patient file, whose data is it really? Welcome to Section 4, the consulting doctor dilemma. This is where professional clinical independence crashes right into corporate hospital liability.
It all comes down to a doctor's exact employment status. Are they officially on the payroll with employment status, or are they independent pros making their own calls? The source points out that many hospitals rely heavily on consulting doctors who make entirely independent decisions on how patient data is processed and disclosed, and that completely dictates the legal dynamic. If a doctor acts independently, they might be carrying the data fiduciary liability right there in their own briefcase, making them and the hospital joint data fiduciaries. It's a massive compliance hurdle.
All right, zooming way out to the widest ring of our healthcare ecosystem, we have to look up. We have to look at the massive corporate structures hovering above these local hospitals and ask, does the brand on the building actually hold the liability for everyone inside?
And that brings us to our final stop, Section 5, Umbrella Brands and Franchises. This is without a doubt the ultimate gray zone in modern healthcare networks.
The source introduces a truly wild concept here to deal with this corporate complexity: the possibility of a super data fiduciary. This is not your standard fiduciary classification. This is a potential legal status designed specifically for an overarching umbrella brand sitting at the very top of a franchise hierarchy.
So here's the exact dynamic that creates the need for the super data fiduciary. Step 1. The umbrella brand uses its massive name, its marketing, and its brand sharing program to attract the patient. You trust the familiar logo on the building, right? But then step 2. The actual franchise hospital, which is a completely separate legal entity, renders the clinical services entirely independently. Because the umbrella brand pulls you into the ecosystem, but the franchisee handles the actual medical data and care, figuring out who holds the data liability requires this new super status to be seriously considered.
So, what does this all mean for you and the future of healthcare compliance? Well, standard out-of-the-box data protection frameworks just fail here. They simply don't capture these unique relationships. Our source makes it very clear. The upcoming Data Governance and Protection Standard for India, the DGPSI hospital framework, absolutely must adapt to cover these special situations. It has to secure everything from the local independent diagnostic lab all the way up to that super data fiduciary umbrella brand. As we wrap up this explainer, I want to leave you with something to really ponder. Where are the unseen data vulnerabilities hiding in your own healthcare network? Is it an independent consultant, a remote surgery partnership, maybe a franchise clinic? The authors of the source material are actively seeking your input right now, inviting professionals to send in their views to help shape the DGPSI hospital framework. Identifying these gray areas is absolutely the first step toward true patient safety. Keep an eye on those vulnerabilities in your network, and thanks so much for joining me today as we unpacked this. Keep your eyes open for more explainers on the future of healthcare data.